You are tuned in to Recovery TV, the voice of hope. Discussions and information on addiction and mental health issues. Here is your host, John J. Tassoni Jr., with today's guest.
Welcome to Recovery TV, and I'm your host, John Tassoni. This is the voice of hope. My guest today is Linda Hurley. Linda Hurley is the CEO President of CODAC of Rhode Island. Welcome, Linda, and thank you for joining us today.
Thank you for having me.
So, Linda, I want my viewers to realize and know what CODAC is all about, how many locations you have, what is it with MAT. The floor is yours.
Okay, thank you. So CODAC Behavioral Health Care has been in Rhode Island for 52 years now. We're having our 50th anniversary next spring because of COVID. We started in 1970, and it was not a medication-assisted treatment or opioid treatment program at the time, but we have grown since then. So we now have 8 sites in Rhode Island and 1 in Massachusetts.
Wow.
Yeah. We have 7 community sites, and they are in North Kingston, Newport, Pawtucket, Cranston, I lose track sometimes, East Bay, Providence. We also have one that we're really excited about because it's co-locating with Thrive Behavioral Health, so that we'll be able to provide comprehensive treatment for severe and persistent mental health issues, for physical medical treatment, as well as substance use disorders and opioid treatment using all of MAT. So that's a very exciting project that we're having. And then, of course, we have the one that we've actually had a great deal of national exposure for at our Department of Corrections co-located facility.
You know, I wanted to talk about the corrections piece because you are nationally recognized for that piece. And the statistics coming out of that program are mind-boggling to me.
Yeah.
So can you give my viewers a little bit of background on the statistics? Because I don't believe that people realize that this is going on behind the walls.
Yeah. So we actually have given this treatment to DOC, and we call them patients, inmates, residents. So in one form or another since 1994, but in 2016, when we saw an extremely high percentage of the opioid overdose deaths, 25% actually, 25% of the people that died in 2015 from opioid overdose were recently incarcerated. So it was recognized through the task force that, you know, this is a highly vulnerable population.
Right.
So we created the program with Dr. Jennifer Clark, and we provide all FDA-approved medicines for opioid use disorder to all people that need them, regardless of anything. When they demonstrate a need, we provide them. And we have, often the term is called a warm handoff. We actually guarantee that 24 hours after somebody is released from prison, that we will get them connected with the treatment of their choice. So it's the exciting piece, and Brown University does our data analysis and evaluation for us. It has been remarkable. At one point, we had a 61% risk reduction, relative risk reduction, in the number of deaths in 18 months since we initiated the program. You never see this in medicine. It's wonderful.
Yeah. Now, the question that the viewers would probably ask is, how do these patients come to you as far as, do they say, I need help? They talk to someone behind the walls and said, listen, I need treatment. Is that how that goes?
It goes 2 ways. When somebody is already incarcerated and probably sentenced at that point, then they say, I need help. and it's as simple as scheduling it, and they are provided a meeting with a counselor, a meeting with the doctor, and they begin their medication-assisted treatment protocols. Also, at the point of commitment, we are actually reaching that at the point of commitment. If someone comes in and they are in withdrawal, have a documented history of some form of documented history of opioid use disorder, or if they come in already being maintained in the community, and we'll just transfer them and then transfer them back upon reentry. So there's 3 ways that people can do that. They can request it while they're in. We strongly encourage people to request it at a minimum 90 days before discharge if they've been sentenced for a longer period of time, because that 48 hours is the most vulnerable time for folks, because they're not physically dependent anymore, but they still have the brain change that results in the disorder.
Right. So if people are on MAT for a long period of time, we'll say someone's sentenced to 5 to 7 years to 10 years, can they come to you and say, I don't want any more?
It's all patient choice.
Patient choice. So let me ask you another question.
May I say one more thing?
You may.
I think that it's really important to know that both inside the prison and outside the prison, everybody, it's patient choice. And there's nothing wrong with stopping and starting. There's nothing wrong with having to start several times, and there's nothing wrong with changing your medicine. You can have buprenorphine, you can have methadone, you can, depot naltrexone. You can have those things. Try them. We'll be right there with you, and if it doesn't work, we'll give you something else. There's nothing wrong with changing medicines.
See, that's been a big myth
Yes.
for a long period of time, along with the issues of stigma.
Yes.
Your program's nationally recognized, and it's so nationally recognized that you got a phone call from Massachusetts. Is that correct? To start it in Massachusetts.
We did. We have been there for a year and a half now, in Hampton County, in the western part of Mass, that is dramatically hit hard right now by this disease. And the entire state was hit, as was New England, but there's been more response where there was more population. So the eastern part of Mass kind of picked up a little earlier than we did. But Sheriff Cochi out in Hampden County just did a beautiful job.
When you look at what Rhode Island and also the whole United States and the world are going through right now is COVID. How has that affected your operation, and how has that affected your clients?
Okay. The operation is the easiest question. So our operation was all about balancing risk. So we were mitigating risk of exposure versus mitigating risk of misuse in the community. So how did we, 1 minute, excuse me, I'm sorry.
No, that's okay.
So basically we gave a lot more take home so people could go home and self-quarantine, especially during April, May, and June, when it was really kind of a frantic lift, or frenetic kind of how do we help? We're always 3 days behind. So that was telehealth and expanded regulation around take-homes is what we did. And then our patients became increasingly isolated. They were very afraid we were going to close and not have they wouldn't be able to get their medicine. So we did a whole lot of public relations stuff, PS public service announcements letting people know.
Right. This has been quite an experience for all the people in substance use disorder and also mental health. And I want to thank CODAC personally from myself and Recovery TV for the work you do with Rhode Islanders, because you're saving lives. And you've been listening to Recovery TV. I'm your host, John Tassoni. We'll be right back after these messages.
When people find out that I've been sober for a while, they say, oh, you must have great willpower. The truth is I have no willpower. And that's why I decided to get help. you know, it must take a lot of strength to stay sober. No, it takes strength to ask for help. And once you're done, once you've decided that you don't want to live like this anymore, the real strength and the real courage comes when you ask for help. And then you'll find that people are willing to give that help, and that's when your life can really begin.
Local 57 Operating Engineers is Rhode Island's source for professional heavy equipment operators. For the last 120 years, Local 57 members have worked on all of Rhode Island's major construction projects, including buildings, roads, and bridges. If you're looking for professionally trained and licensed operators to run your excavators, loaders, cranes, or any other type of construction equipment, give us a call at 421-6678. If you're an experienced heavy equipment operator and would like to join our team, give us a call.
The Parent Support Network is committed to supporting and assisting peers. Together, they're working with statewide and national partners to empower children, families, and individuals through dynamic supports, education, and advocacy to prevent abuse and neglect and progress toward universal health, wellness, and recovery. A location is near you. Child and Family Visitation and Training Center in Warwick, Hope Recovery Community Center in Middletown, Hope Recovery Community Center of Washington County in Westerly, or online at psnri.org.
Serving the community for more than 30 years, 3 generations of our family at Wesco Oil have been providing reliable comfort to your home.
From oil delivery to installation and service, you can trust us to maintain your heating and cooling systems year-round. Visit us at bewarm.com to choose an option that best meets your needs. Be cool or be warm. We've got you covered. Honest service at a competitive price. Wesco Oil Company.
I started getting in trouble when I was real young. I was bringing knives to school in the 3rd grade. I started hanging out with the wrong crowds. I envisioned that if I wasn't dead by 26, I'd be in jail. I never had plans past that. Tides give me the opportunity to start a new life fresh. So now to be 28 with 4 children, married, manage this restaurant, living in a house, it's a miracle. Life is incredible, and Tides is who I have to thank for that.
Welcome back to Recovery TV, and I'm your host, John Tassoni. This is the Voice of Hope. My guest today is Linda Hurley from CODAC. She is the President and CEO. Welcome, Linda, and thank you for joining us today. And also, from the bottom of my heart, thank you for being a sponsor of Recovery TV.
You're welcome.
So I want to talk a little bit about harm reduction. There's been a big conversation about harm reduction. The legislature passed a piece of legislation to start a harm reduction site in Rhode Island for, I believe it's April of next year. Mm-hmm. What's your thoughts on that?
We were very pleased. Harm reduction it's had, the term itself has had a long history of being misunderstood. Okay, this is a disease that is chronic and recurring. So what we need to do is minimize harm, keep people alive, try to keep them healthy until they reach whatever level of recovery their goal, you know, whatever the role of, whatever their, but whatever their goal is.
Right.
So it might not be mine, but it's theirs. Mm-hmm. But harm reduction is just lowering the risk of harmful outcomes until somebody is ready to move forward. So I think that it's very exciting. We were the first legislation in the country. I've gotten a lot of calls on it. And I think from my understanding, speaking to the sponsors of the bill, is we have been working on this for 3 years now, longer than that actually, but the formal committee was 3 years. And it is a harm reduction center in terms of this center is going to provide referrals for doctors, dentists, there's going to be nurses present, there's going to be fentanyl testing strips so that if someone is using a product that's been contaminated with fentanyl, that they'll know, and there's going to be Narcan available. We're hoping there's going to be peer recovery support specialists. It would be great to have a clinician available, a counselor available to talk about, you know, what's real if somebody is ready to move forward. So this is a wonderful, wonderful opportunity, you know, and again, we've seen a remarkable rise in sepsis and other kinds of blood infections due to IV drug use. I mean, this answers so many of the questions, and often when somebody's thinking about, well, my family isn't impacted by this, well, maybe it isn't. If you go out far enough, it might be.
Yeah.
But it's your tax dollars too, and this is saving tax dollars.
Yeah, and I know people don't realize that the more individuals who have a substance use problem we keep out of the emergency room, it's saving money. You know, there were so many calls that I received here pertaining to when this legislation passed, where people would say, why are you helping these drug addicts stick needles in their arms and you're not helping them? Well, they're not looking at the other side of the coin. You know, getting back to when I got into the field, it would have affected 1 in 5 families. Now we're down to 1 in 2 families. This is a rising epidemic along with COVID. They're running on the same path. We're going to probably break another record this year of overdose deaths.
Right.
And that's not good. No. That is not good, because we're losing too many young people and middle-aged people to this fentanyl rush that we're getting here in Rhode Island. There's more and more fentanyl coming in here on a daily basis, and we have to somehow eradicate it so we have people that can be productive citizens, go back to work, instead of being on the side that they're on. We need to flip it on the other side.
There's 78% of the confiscated heroin or opioid product in Rhode Island is fentanyl contaminated, and it's close to 90% nationally. This is a tremendous risk to all of the residents and the citizens of Rhode Island and the country. We need to know that.
Yeah, and you know, people don't realize too that Rhode Island, because we're such a small state, we are the corridor. 95 is the corridor. They're running from Florida or Mexico right up until the Canadian border. That we are the corridor, and this is the highway to get high, and it runs right through Rhode Island, and that's a serious, serious problem. But the work that your organization does behind the walls in the 8 locations that you're in the state of Rhode Island, it's fabulous. You know, as a kid growing up, you always hear when you had a snow day, CODAC is closed, CODAC is closed, CODAC is closed. And I always wondered what CODAC was until I got into this and this arena, because I thought it was a school, because they were closed when I was closed going to school. So, you know, how long have you been the president and CEO at CODAC?
I believe it'll be 5 years.
You believe
Yes.
it'll be 5 years?
Well, I've been with CODAC for this month. It will be 34 years.
Wow.
So, yeah. Well, it's an organization that lives its mission through all the changes we've seen for this amount of time.
Right.
The mission has always been primary. You know, not enough money, well, never too much money, but all different kinds of, you know, variations in the social context and the economic context. But the leadership has always been committed. It's always about the patient.
You brought up a good word. Money. The rates in Rhode Island are horrible. Haven't been changed in upwards of 20 years. 15
as I'm aware, yeah.
So tell me how you operate with not getting a raise in 15 years.
That's a very good question. I have a lot of wonderful, wonderful employees who are brilliant and creative, but we are coming to the end of, you know, that creativity rope. We simply we underpay for bachelor's and master's level clinicians. We have a hard time keeping staff, especially the staff at the lower rates. And so people stay because they're committed. People stay, we'll give them everything else, extra days off. We pay for training, we pay for licensure, we do all of that. But the rates are lower than Mass, lower than Connecticut, lower than Maryland, New England.
And lower as more than fast food places.
Yeah.
Are paying more than paying our staff.
We just lost someone to Petco. It makes me very sad.
Well, maybe they were going into doing
Pet
work
therapy.
with pet therapy. So, you're listening to Recovery TV, and I'm your host, John Tassoni. This has been an eye-opener for the people who are watching this show today, from Linda Hurley from CODAC, the president and CEO. We're going to take a break, and we'll be right back after these messages.
Treatment is often far more successful when individuals are offered both medication and behavioral therapy. CODAC Behavioral Health Care is Rhode Island's largest, only nonprofit, outpatient provider of care for opioid use disorder.
Our compassionate clinicians deliver the highest level of care for patients.
Through CODAC's medication-assisted treatment program, patients are prescribed methadone, buprenorphine, Suboxone, and naltrexone. For a confidential conversation, call CODAC.
If you or someone you know is struggling with a mental health or substance abuse issue, the members of Horizon Healthcare Partners are here to help. CODAC, Community Care Alliance, Newport Mental Health, Thrive Behavioral Health, and Tides Family Services serve the behavioral health needs of all Rhode Islanders. We also operate BH Link, the state's 24/7 behavioral health emergency center. For help, call the 24/7 hotline at 401-414-LINK. For more information, visit Horizon Healthcare Partners at hhpartners.org.
If you're struggling with addiction to pain pills or heroin, it's time to call Groups Recover Together. Groups will get you the medicine you need to feel better.
When I took Suboxone, I felt just like able to function, no sickness, no, anxious feeling.
And we'll give you the support you need to build the life worth being sober for. The time commitment is minimal, just 1 hour a week. You can meet with us in person or virtually. Call now to get started.
Addiction Recovery Institute, with locations in Pawtucket and Warwick, have been the leaders in treatment of opioid use disorder since 1993. Addiction Recovery Institute offers same-day admission, no waiting list. Services include medicated assisted treatment, detoxification, and substance counseling, always providing care to those who are most in need with dignity and respect. For more information, visit methadone.com.
Every week I work in stadiums filled with thousands and talk to thousands more on the radio, which means people who come from every walk of life. And I know that many, like my own family, have grieved over loved ones caught in the grip of addiction. 8 years ago, we lost my nephew to an overdose. But I've also seen in friends and even fans who've shared their stories, others break that hold and regain control of their lives. You can do the same. Please know you're not alone.
Welcome back to Recovery TV, and I'm your host, John Tassoni. This is the voice of hope. My guest today is Miss Linda Hurley from CODAC. She is the CEO and president. So Linda, again, thank you so much for joining us, and thank you for being a sponsor of Recovery TV. I have just a couple of questions left. What are the barriers that people are looking at to get into treatment?
Well, the largest barrier, to access is what they call stigma, which is really fear, lack of knowledge, bias, and then that results in discrimination. So It's a tiny word that's huge. Yeah. And that really, a lot of that is based on misinformation. So medication-assisted treatment, number one, is a medicine that helps the brain heal from opioid use disorder or other substance use disorders. Just like, as others have probably said many times, just like your cardiac medicines help your heart, your insulin helps your pancreatic system, all of that is the same thing. It's just that we also have a stigma about diseases of the brain. For some reason, when we have a disease of the brain, of course it impacts our behavior, and then individuals think, oh, well, there was volition involved in this. They chose to do this. They chose to do that. And the reality is that it is a disease that causes the survival part of the brain to break through the grown-up brain, the executive function, the cognitive. Right. So the medicine is just a part of treatment that helps the brain heal. In the meantime, there's counseling, there's outside supports, they call them internal and external recovery. That's something that CODAC and other treatment providers all provide. It's not just the medicine, but the medicine is important.
Yeah.
So that's critical, I think, and that's the biggest barrier. I think people not understanding truly what we can give to them, the care we can give to them, and then the stigma of the external.
Right. So Linda, give my viewers your phone number.
It is, this one. It's 401-461-5056.
How about a website?
CODACinc.org.
CODACinc.org.
And we update it all the time.
All right. Well, you've been listening, you've been watching Recovery TV, and I'm your host, John Tassoni. Linda Hurley from CODAC does a fabulous job in the state of Rhode Island and Massachusetts now, nationally known organization with the treatment behind the four walls. So this is Linda Hurley, and I'm your host, John Tassoni. We'll see you next week. Thank you for joining us.
I think when you're actively struggling with an addiction, you don't realize the harm that it's causing to the people in your circle, in your family, and your friends. You know, by quitting and getting help, I was able to heal a lot of relationships that were damaged, and you find that people come back to you. Someone used to say to me that it's darkest just before dawn. So if you think that you've gone too far, it's not true. No matter what problems you have, your life can get better if you get help.
Alcohol and drug addiction, depression, anxiety, PTSD, they can all seem overwhelming, but you don't have to face them alone. At Trinity Village, we are committed to providing addiction treatment that works. We specialize in offering integrated care for co-occurring mental and substance use disorders. We offer cutting-edge medicated assisted treatment and medication management. We are now offering virtual care to get the treatment you need from the comfort of your home. If you or someone you love needs help, call or visit us online at trinityvillage.org.
East Bay Recovery Center in Warren connects people in recovery to the supports and activities that make long-term recovery a reality. People with lived experience work to engage individuals and serve as a guide for new recoveries. The Peer Recovery Specialist's aim is to engage high-risk individuals being served in the community to vital treatment and services and follow-up to ensure the connection to treatment and services is maintained. For more information, visit ebcap.org or call 302-6231.
Treatment is often far more successful when individuals are offered both medication and behavioral therapy. CODAC Behavioral Health Care is Rhode Island's largest, only nonprofit, outpatient provider of care for opioid use disorder.
Our compassionate clinicians deliver the highest level of care for patients.
Through CODAC's medication-assisted treatment program, patients are prescribed methadone, buprenorphine, Suboxone, and naltrexone. For a confidential conversation, call CODAC.
Sunday mornings, join host John J. Tassoni Jr. for Recovery TV, the voice of hope for addiction and mental health issues. Tune in, tell others. Sunday mornings, 11:30 on CW Providence and 9:30 on MyRI TV. Brought to you by AdCare.
When it comes to home improvement, you just don't know who to turn to, especially when it comes to a painter or contractor. Years ago, I found a company I could trust, Lopco Contracting. Lopco has been painting and repairing homes in southern New England for almost as long as I brought the news into those homes. From replacing doors and windows to fixing leaks and rotted wood. For a contractor you can trust, call Lopco now, 1-800-PAINTING, or log on to LOP as in professional, cocontracting.com for the personable, particular professionals. Salud.